Well, thank you very much. Thank you for the kind invitation. As you've heard, I'm Chief Scientific Advisor, and I'm also Chief Executive Officer for the National Institute for Health and Care Research. As will become apparent later, I'm also a Professor of Obstetrics and a Consultant Obstetrician, and so I stand here familiar with Revvity's work in this area. The Minister mentioned a revolution, and I think it's interesting that the word diagnosis and diagnostics, they're relatively new terms. They sort of date to around 1789. So, for those of us who didn't do history at university, those were about the time of the French Revolution. And I think what we should think about is how to really take on that call to arms from the Minister to say what is the revolution that we are living through and should be part of to really drive diagnostics, to think about how it really feeds into that building a health and care system fit for the future. And we can see that across so many different areas. So from the NIHR perspective, as we're the largest funder of healthcare research in the UK. So what are we doing on this? We fund through four sort of intertwined routes. We fund infrastructure, programs, we grow the next generation of researchers, and we fund research delivery. Interestingly, having just come back from Asia last week, that funding of across all of those four areas is actually relatively unusual for a government funder, and we have others from around the world looking at us with liking what they see. But it's not just enough to do input, you've got to ask about output. And we do this to drive pillars related to four areas: impact, innovation, investment, and inclusion. So when the Minister asks, Lucy, what is NIHR doing? I need to be able to show what it actually translates into, not just that I'm spending the money. We've got real world-class science in the UK, and you only have to look at our standings in the top 10 universities. We've got an NHS with many assets, and I know Steve Powers will come on to talk to that. We've got a really innovative regulatory system that we shouldn't take for granted as to where they're going. And we've got NIHR funded research delivery across the country. And with that, we really aim to be world leading for commercial and non-commercial clinical research. So just to sort of touch on what that looks like for our infrastructure, an example of our commitments is our announcement in April this year of 42 million to fund 14 new health tech research centres. Go and have a look at where they are, what their areas are across the country. We know that the geographical spread for diagnostics is very different to large pharma, and we really see how we want to support up and down the country. So sort of a whole range of investment for medical devices, diagnostics and digital technologies, so that people can better monitor their health. We're seeing the explosion of wearables and want to think about how that integrates, how we can diagnose the ill health sooner, and how we improve management. And I see that as an obstetrician. And the health tech research centres, like all of our work across NIHR, involves patients and users and carers at all stages. Each centre is hosted by an NHS organisation because we think it's vital to bring that together. And so that's across a range of diseases like cancer, dementia, mental ill health. And then that translates into treatment options. For our programme spend, we've got our Invention for Innovation programme. Mike Lewis is standing at the back. He's our programme director. And that again really works aims to work with industry in a way that we know is highly desirable. And in the last few months, we've just announced our NIHR Challenge funding, backed by 50 million to tackle maternity inequalities. As an obstetrician myself, I happen to have done development, evaluation and implementation of a diagnostic in pregnancy, placental growth factor, which happily is a Revvity product. And I've seen the power at first hand of taking an effective diagnostic from bench to bedside, campus to clinic, and every week I see what a difference it makes to our pregnant women. So I'm just going to finish by talking about research delivery for the Generation Study, which you will hear more about. We fund around 11,000 individuals across the NHS to deliver research. So for all of you who want to be running and who already are running research in England, that's what we do. And I really hope that we can pull together more of a discussion about the generation study with Rich Scott, Chief Exec of Genomics England here. That's one aspect, but for example, we've got our partnerships with Moderna and BioNTech, really talking to that intersection with life sciences and how we see diagnostics as a crucial part. So through that R&D offer, we can evaluate new diagnostics, new therapies, and genetic screening, as you've heard, to see how they are part of the government's health and growth mission. They are really closely intertwined, and that aims to build that health and care system for the future. If I've got one ask of you, it's to come and work with us at NIHR. Come and talk to us about your novel ideas. It should be a partnership and a collaboration, and I very much want to go on that journey together. Thank you.